obstetrician gynecologist. After 9 months of gestation, the moment of delivery arrives. It's childbirth that I am speaking of. For approximately 237 days, a woman goes through an amazing process in which a life is created within her. This process is known as a pregnancy. The success within this process not only depends on the mother or the child, it also depends greatly on the help of a physician who has expertise within that field. This physician may be known as an obstetrician, a gynecologist, or both, also abbreviated as an OBGYN. Social media has reported many cases in which women involuntarily find themselves in a complex situation where they are forced to give birth in completely random places. According to an article on ABC News website, last updated on July 9, 2014, recently 30-year-old Troy Dickerson from Rosenberg, Texas, was able to capture the moment in which he was obligated to successfully deliver his newborn son outside of a hospital. As domestic individuals, we must be aware of destined emergencies that might occur when expecting a new family member. As a biology major student at CSULA, I have found myself interested in the OBGYN expertise and wanted to learn more about it. Learning about the responsibilities and process towards obtaining the professions of obstetrician gynecologist will help us understand the purpose and importance of this career. First, I will inform you what an OBGYN is. Second, I will discuss its academic path. And finally, what it's like to be an OBGYN. In order to better understand what an OBGYN is, we must explore the responsibilities of an obstetrician, and second, explore the responsibilities of a gynecologist. Obstetrics is a branch of medicine concerned with childbirth, preconception, and postnatal care as well. An obstetrician's main focus is caring for both the mother and the unborn child throughout the whole pregnancy. During a pregnancy, the expecting mother visits an obstetrician multiple times. During these visits, both the mother's health and infant's progression is evaluated. If something were to be wrong with either the unborn baby or the mother, an obstetrician would be responsible in demanding laboratory tests, ultrasounds, or any other analytical processes that might uncover the problem. Delivering a baby is one of the most important tasks an obstetrician will decide. An obstetrician does. He or she will decide what would be the best way to deliver a baby according to the situation. If normal birth is not possible, they are able to perform a cesarean surgery. Aside from prenatal care and delivery counseling, possible parents about fertility is also one of the things an obstetrician does. They will discuss factors such as genetic problems that might affect their capability of having children. Gynecology is a branch of medicine that focuses on women's health and reproductive system well-being. A gynecologist deals with menstrual cycle problems, infectious diseases, reproductive organ problems, and even sex hormones issues. In many cases, women suffer from ovarian cysts or tumors, and usually what a gynecologist does is order a sonogram to be able to understand the gravity of the situation and proceed with a solution. Aside from this, gynecologists also perform breast exams to check for any abnormalities that might lead to something serious such as breast cancer. Now that I have discussed what an obstetrician and gynecologist is and what their duties are, I'll move on to explain the educational path towards obtaining this career. In order to fully understand this career, we must discuss the process of becoming an OBGYN. The road to obtaining a significant career like this one is very long. To become an OBGYN, you must receive large amounts of education. This might take up to 12 years and it even continues after. First, you must attend undergraduate school, which can be which may take up to 4 to 5 years depending on your major. Most people choose a science major. An example, my major is biology. Then attend medical school for 5 years if you are including a year of research. And finally, you do 2 to 8 years of residency. An obstetrician, gynecologist residency program is usually 4 to 4 years without self-specializing. During residency, you are exposed to a wide range of things that you will learn how to do and or treat for all 365 days of each of those 4 years. Now, in order to be able to complete all these years of education and to even be admitted to a good med school or any university in general, students must keep in mind that they must meet requirements and receive impressive grades on exams. Aside from other years of education, there are specific exams you must take, certifications you must receive and maintain, and requirements you must meet. One of these exams would be the MCAT. In order to be able to apply to a medical school, you must take this test and receive a good score, and then you'll be able to apply to a medical school. While in medical school, board examination will begin, and you'll receive both your licensure and drug enforcement agency numbers. There are specific board certifications for each specialty. For an OBGYN, there is written examination which occurs the last year of residency. You must maintain a good score to be allowed to even prepare cases for an oral examination, which is also another requirement. Then there is maintenance of certification, a process that requires you to do continuing medical education credits, and then American Board of Obstetrics and Gynecology based baseless and presentation, followed by a couple more written exams and oral work every year. So the process never actually ends, because every year you have to be taking these tests to keep the certifications you already have. So after defining what an OBGYN is, discussing the process to becoming one, let us now explore the life of an OBGYN. While it may seem like becoming an OBGYN is too difficult or not worth it, there are many upsides to it. I will now discuss what the possible incomes for an OBGYN physician are, and then I will discuss both the job opportunities and the title. First, according to Dr. Carmen Woods Hollowell, an OBGYN from Park City, Illinois, and Lindenhurst, Illinois, in a 2011 interview by Mark Luber, it can be anywhere from $80,000 a year to $1 million a year. The annual income for an OBGYN may vary. It all depends if you will be doing private medical-based or hospital-based practice. If you work for a hospital, it will pay you a flat salary, whether you see one person or 1,000. Generally, according to the Bureau of Labor Statistics, in 2011, $218,610 was the average annual salary for an OBGYN. Next is job opportunities. The job lookout for physicians and surgeons is positive. Between the years 2010 and 2020, the employment for surgeons and physicians is expected to grow 24%, which means a lot of possible job opportunities will be out there. And now work attire. It is of essence to dress appropriately for this kind of job. As a doctor, you are expected to look responsible, reliable, and professional. So when you're a doctor, you have to remember that you're going to be speaking to a lot of patients, and those people trust you with their bodies and stuff. So like your appearance actually does matter when you're speaking to them and giving them your service, you know. So what they usually wear is men usually wear slacks, a shirt, a button-up, and like a tie. And traditionally, all doctors wear a lab coat. So that's what they will always wear on top of whatever they end up wearing. And now that we know what an obstetrician gynecologist is and what it's like to be and become one, let's wrap things up. It is important to discuss this career in order to understand the main purpose and importance of being an OBGYN. First, I described what an OBGYN is. Secondly, explain the academic process for this career. And finally, explore possible outcomes. So a birthday party every day, we wouldn't like that, right?